The onboarding of new patients nowadays, since we have the iTero, is really, we scan every patient. It's for us an easy tool to talk with the patient about their oral situation. For example, we can show them how their teeth would look like when they're perfectly aligned. Or maybe when a patient has caries, we can point it out on the screen using the NERI system. For example, when a patient has interest in Invisalign, we will collect all data needed. For example, the scans, the intraoral scans we make with the iTero, some normal pictures and the X-ray. This all we send to Invisalign, and Invisalign comes back with the ClinCheck. This ClinCheck we're gonna discuss with the patient, and here we will decide together with the patient in which way we want to move the teeth and what the end result may look like. The next step will be a team meeting or a so-called GP meeting. There we will discuss the new patients that entered our clinic and decide which path they're going to go. Invisalign, restorative, or a combination of both. What's really extra for us is, for example, the possibility to monitor the wear and tear of the dentition of our patients. Yearly we can scan them and just put the images over each other and show the patients the wear and tear of their dentition and talk about it. That's important. NERI is another cool function of the iTero scanner. We can use this to show the patients, if they have cavities, where they are. So together with the patient, we can scroll around the mouth and show them exactly where the problem is. And this makes the communication with the patient a lot easier. The patient's response on a digital workflow is enormous. They love it. They really feel that they're in the driver's seat. They have control over their own situation. We as a team feel that it's so nice to have more compliance, and it makes the way we can work with the patient towards the end result so much easier. Now we use this in our clinics on a daily basis. We can only ask ourselves, what's in it for the future? What are the new innovations going to be? We're so curious.